Hello, my name is Michael Whitehead. I am a licensed marriage and family therapist and a registered play therapist supervisor. I have a PhD in family therapy, and today I wanted to talk a little bit about play therapy and why it would be advantageous for parents and therapists to utilize play therapy. As a parent myself, I want to make sure that my kids get the best treatment possible, as well as make sure that they're making the most progress. As a therapist, I want to make sure that my clients are also making the best progress possible. And so throughout my training, I have discovered that play therapy actually is pretty effective. I wanted to address a few questions and concerns that I often get from parents and therapists about play therapy. I'm going to speak most specifically to parents because that seems to be the biggest need for helping parents understand what play therapy is and whether or not it's actually effective. So today I'm going to highlight a few different aspects of research and talk a little bit about that so that way parents can understand how effective play therapy is and why it's important to seek out a registered play therapist in order to do that play therapy. So first, I wanted to talk a little bit about some of the research on just traditional child psychotherapy. And this is child psychotherapy like you would think of talk therapy, but just applied to children. As you can see with these numbers, the effect sizes are pretty good. We've got some pretty large effect sizes. And just for a quick review so that parents are understanding, an effect size is a statistical measure that allows us to see if an experimental treatment actually makes a difference in a person's life over what we would consider the control group. So as you're looking at some of these different treatment conditions and treatment types, you see that ADHD, anxiety, conduct disorder, and depression have varying levels of effect sizes for the different types of therapy that children might receive. Over on the far left-hand side of the screen, you see a conversion of percentage of effect that each treatment might have. So an effect size for, say, anxiety of 0.55 could be translated to be about 70% effective over a control group or over a waitlist group. Over here on the far right-hand side, you see that the different types of treatment, whether it's individual child therapy, family therapy, or multi-systems therapy, have different effect sizes as well. So keep that in mind as you're looking for therapy for your child or for yourself, that generally family therapy or multi-system therapy tends to come out looking a lot better and having more effectiveness for the treatment issues that you're looking for. I also wanted to highlight that placebo, or whether or not somebody believes something is happening, or waitlist also have an effect on whether somebody gets better. So that can't be or thrown out there. We need to make sure that that is also highlighted as well. Now, as we look at the research on play therapy, so this research was on traditional child psychotherapy, and we go to the research on play therapy, and we see that for about the same type of treatment concerns, so internalizing problems would be like depression or anxiety, externalizing problems would be like conduct disorder or defiance, combined or family problems are also listed there. We see that the effect sizes for play therapy, when used properly, are actually more effective than traditional child psychotherapy. If you look over on the far right-hand side of the screen, that percentage conversion, where we have anxiety having an effect rate of about 70%. If you look at internalizing problem, it's a 0.81. So that means we're about 80% of effectiveness. So about 10% more effective by using play therapy than traditional child psychotherapy. I also wanted to point out that different types of play therapy have different ratings for effectiveness as well. So there are three generally different types of therapy. You've got directive play therapy, where the therapist is the one who's in charge of the therapeutic process. There's non-directive play therapy, traditionally called child-centered play therapy, where the child is the leader in the therapeutic process, and then filial therapy or family therapy that is play-focused. And each of those have a different level of effectiveness as well. And as you can see in this research as well, that filial or family play therapy was actually much more effective than either non-directive or directive play therapy. And I have this reference over here in the middle for the slide that we just saw as we look at the differences between the effectiveness of play therapy versus traditional child psychotherapy. So there is quite a big difference, and we see that play therapy is effective from the research. It has been shown to be an effective evidence-based intervention. So the question that I want to answer is, why do so many parents think that play therapy is not effective? Part of that is because when parents are told that there's play therapy going on, they have a lot of misunderstandings of what is going on in the room, or the therapist might not actually be a play therapist. So I want to talk a little bit about what play therapy is, so that way if you are looking for play therapy, or if you have a child who's in therapy and they say they're doing play therapy, you can ask some questions to find out if it really is play therapy. So the basic understanding of play therapy is play is the child's language that they use to convey their needs, and the toys are the words that they are using to do so. However, what I hear a lot out of parents is they're just playing. All they're doing in the room is playing. And to a child, that might be the case. However, if the therapist isn't talking to you and explaining what is going on in the room, then no therapy really is being done. If all you do is play, then you're not really doing therapy. A play therapist uses a variety of different interventions. They're labeled right here as tracking, reframing, encouragement, reflection, and limit setting. And these interventions, along with a few others, are utilized in play therapy to help children develop self-regulation skills, to help children develop relationship processing skills, and also to be able to just process what's going on for them emotionally. So play therapy does have a lot of really evidence-based and specific interventions that are important to keep in mind. And you can ask your therapist if any of these types of interventions are being used. You can ask your therapist what type of play the child was doing during the therapy session, so that way you can identify if play therapy was actually being utilized in the proper way. If a therapist can't identify the type of play or the intervention they used during that session, they're likely not a play therapist. So I wanted to quickly run over a few different terms you might see or might hear of when thinking of play therapy. I already talked about non-directive and directive play therapy and filial therapy, but there are a few others that are like prescriptive play therapy, ecosystemic play therapy, theraplay, ought play. So those are all different models of play therapy that you might see or you might be introduced to, and recognize that those are all evidence-based or evidence-informed play therapy models that actually make a difference in a child's life. And if you are interested in the research, I would encourage you to ask the play therapist to show you the different research articles that they're aware of that show that what they're doing in the room is actually effective. The next thing I want to talk about is, what is a play therapist? Because a lot of people throw that term out. A lot of people say they do play therapy, but not a lot of people really understand what it takes to become a play therapist or to say that you are a play therapist. Now, there's a national organization in the United States called the Association for Play Therapy, and they regulate the term the registered play therapist. And that's what you'd be looking for when you have a child who is doing play therapy. There are a lot of people and a lot of therapists that will use play in their therapy interventions, and that might be evidence informed, but if they say they are a play therapist, they will likely be a member of the Association for Play Therapy or be a registered play therapist. And here are some of the requirements and the foundational requirements of what it takes to become a play therapist. And all of this has to take place in no less than 2 years. So a person who who is wanting to become a play therapist has to be under a supervision of a registered play therapist for 2 years or more before they can earn that credential. So if somebody is doing play therapy and they are being supervised by a play therapist supervisor, then they're learning the skills and the requirements to become a play therapist, and that would be a good therapist to see. So the first thing that has to happen is they have to have 150 classroom hours of play therapy training. 50 of those hours can be accomplished through non-contact experiences like webinars, online trainings, reading books, articles, and taking tests on those books or articles. But 100 of those hours have to be in classroom hours. And so that's where the play therapist will learn different techniques, different skills, be supervised in the classroom to make sure that those skills are being utilized appropriately. And then they have to do renewal of continuing education every couple of years with new experiences. And there is a mixture of the different requirements of contact versus non-contact. In addition to that, over this 2-year time period, they have to have 350 experience hours that are supervised by the play therapist supervisor. These hours are experience hours when they are actually with the child and being observed by the play therapist supervisor by a minimum of 5 observed sessions, so that the play therapist supervisor can sign off and say that what was actually taking place in the room was play therapy. And that experience needs to take place over a course of 2 years. And then in addition to that, there has to be 35 direct hours of supervision where it's the play therapist supervisee and the supervisor talking together about those 350 experience hours, so that way those questions are answered, the documentation is done correctly, and they're able to verify that this person actually has fulfilled all the requirements of becoming a play therapist. So when somebody says they're doing play therapy, I would encourage you to ask questions like this. How many hours of continuing education in play therapy have they received? How many of those hours were in contact versus non-contact? How many hours have they been supervised by a registered play therapist supervisor? How many hours were observed by a registered play therapist supervisor? Are they on track to become a registered play therapist? And if not, why not? If they have a good rationale for why not, then you might feel comfortable in continuing to seek their therapy services. If you're not comfortable with their answer, then I'd encourage you to reach out to a registered play therapist or somebody who's being supervised by a registered play therapist supervisor. That way, you're able to know that the play therapy that's taking place is actually evidence-based and is going to be as effective as the research that I showed you previously. Thank you very much for your time. I hope that this was helpful and that you'll be able to utilize some of the information here to find the best services for your child and or educate other therapists out there about what play therapy is. And I hope to be able to provide more presentations or more videos that will be helpful for you and others in the future.